Well, hello there. Did you know that Medicare does not cover physical exams? In today's video, we're going to explain to you the two things that Medicare does cover. Like we said, Medicare does not cover physical exams. So these two things would not include lab work, diagnostic procedures, extra tests, and such. If you combine these with these two visits, then it's considered a physical exam visit, and Medicare would not pay for that, okay? So in today's video, we're going to explain to you the two things that Medicare does cover. The last thing that we want is for you to go to your doctor's office, get a traditional physical exam, and Medicare does not cover the bill. You will have to pay that full bill, okay? So the first thing that Medicare will cover is your Welcome to Medicare Preventative Visit. So this is offered to you within the first 12 months of enrolling in Medicare Part B. Okay, so we're going to go into more detail about the Welcome to Medicare visit. You don't want to add any additional tests with this visit because then it can classify as a physical exam. So it's very important that your doctor stick to the guidelines of the Welcome to Medicare Preventive Visit. Now with this visit, as long as your doctor takes Medicare assignment, this visit would be no cost to you. So let's get right into the details of this Welcome to Medicare preventative visit, okay? During the first 12 months that you have Medicare Part B, you get a Welcome to Medicare preventative visit. The visit includes a review of your medical and social history related to your health. It also includes education and counseling about preventative services, including certain screenings, shots, or vaccinations, like the flu shot, and referrals to other care if needed. When you make your appointment, let your doctor office know you'd like to schedule your Welcome to Medicare Preventative Visit. You pay nothing for the Welcome to Medicare Preventative Visit if your doctor or your qualified healthcare provider accepts assignment. If you have a current prescription of opioids, your provider will renew your potential risk for opioid use disorder, evaluate your pain level and your current treatment plan, provide information on treatment options, and may refer you to a specialist if appropriate. Your provider will also review your potential risk factors for substance use disorders and alcohol and tobacco use and refer you for treatment if needed. Okay, this is very important. If your doctor or other health care provider performs additional tests or services during the same visit that Medicare doesn't cover under the preventative benefit, you may have to pay co-insurance and the Medicare Part B deductible may apply. If your Medicare doesn't cover additional tests or services like a routine physical exam, you may have to pay the full amount. So it's very important that your doctor do not combine your Welcome to Medicare Preventive Visit with other tests, procedures, and labs and such, because like I said, then Medicare may not pay the bill, okay? And remember that as long as your doctor takes assignment, then this visit will be paid for. So let's talk about the second thing that Medicare will cover. The second thing that Medicare will cover is your yearly wellness visit, and this is classified under preventative care. Okay, so you would get this after 1 year of being enrolled in Medicare Part B. And like I said, this is your wellness visit. During this visit, your doctor will develop a plan of care. So let's get into the details of this particular visit. Your yearly wellness visit. If you had Part B for more than 12 months, you get a yearly wellness visit. The yearly wellness visit isn't a physical exam. It's a visit to develop or update your personalized plan to prevent diseases or disability based on your current health and risk factors. Medicare covers this visit once every 12 months. Your doctor or healthcare provider will ask you to fill out a questionnaire called a health risk assessment. As part of this visit, your visit may also include routine measurements, health advice, a review of your medical family history, a review of your current prescriptions, advanced care planning, and more. Your doctor or healthcare provider may use a questionnaire to better understand your social needs and refer you for appropriate services and support. This is called a social determinants of health risk assessment, and it's free. Your doctor or healthcare provider will also perform an assessment for signs of dementia, including Alzheimer's disease. Signs of impairment include trouble remembering, hearing new things, concentrating, managing finances, and making decisions about your everyday life. If your doctor or healthcare provider thinks you may have a cognition impairment, Medicare covers a separate visit to do more thorough review on your cognition function and check for conditions such as dementia, depression, anxiety. Okay, so that is additional testing if your doctor feels like you need additional testing. Okay, your doctor or healthcare provider will also evaluate your potential risk factors for substance use disorder and refer you for treatment if needed. Okay, if you use opioid medications, your doctor will review your pain treatment plan and share information for treatment options and can refer you to a specialist as appropriate. Please note, your first yearly wellness visit cannot take place within 12 months of your Part B enrollment or your Welcome to Medicare Preventive visit. However, you do not need to have a Welcome to Medicare Preventive visit to qualify for a yearly wellness visit. You pay nothing for your yearly wellness visit if the doctor or healthcare provider accepts assignment. It's very important to take note if your doctor or healthcare provider performs additional tests or services during your wellness visit that Medicare doesn't cover under this preventive visit. You may have to pay a coinsurance and Part B deductible may apply. So, if Medicare doesn't cover additional tests or services like a routine physical exam, you may have to pay for the full amount. Okay, so it's very important to take note between these two types of visits, which is your Welcome to Medicare visit and your wellness visit, that your doctor does not perform anything else within your visit. Okay, so no lab work, no diagnostic procedures, anything like that, because it may seem like a physical exam and Medicare would not cover that visit if they combine the two. So please keep in mind that your Welcome to Medicare Preventive visit need to be that. Your doctor should not include any additional tests, lab, diagnostic procedures, or anything like that. It's more about letting you know about preventative services and such. Same thing with your wellness visit, okay? You don't want to combine tests, labs, diagnostic procedures, because it would seem like a physical exam. Okay, if you combine these additional things with these type of visits, then Medicare will look at it as a physical exam and will not pay that bill. So it's very important to keep that in mind. So in today's video, I explained to you the difference between a Welcome to Medicare visit, a wellness visit, and that Medicare does not cover physical exams. If you have any questions, comments, concerns, leave them in the comment section below, and I'd be more than happy to answer your questions. If you need any of these services that we provide our clients, give our office a call. We'll be more than happy to assist you. We never charge for our services. And if you want to see me again, subscribe to the channel. Give this video a like if you enjoyed this video, and I'll see you on the next video. Bye for now. Bye.